Om Shanti.
Om Shanti, ma'am. How are you doing?
Very well.
That's great.
So let's begin the session. Coming to the sitting posture. Keep your back, neck straight, aligned. Gently close your eyes. Go into your asana. Take a deep, prolonged inhalation. Exhale. Inhale. Exhale. Now inhale for the one time Om and Shanti. Take a deep breath. Om. Shanti. 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 Feel the vibration and sensation. Join your both palms. Wrap your palms. Place on your eyes. Very slowly while blinking, looking at your palm gently. Open up your eyes with a great smile. So, in previous session, we talked about the arthritis, bone-related issues, vata problem. Today, we're gonna talk about the problem which related to the kapha. Okay, so kapha common problems are sinus issues, blockage of the sinus, then asthma, bronchitis, tonsillitis, upper and lower respiratory issues is basically related to the vata and kapha also, and some point kapha. Okay, so how we can handle these issues through the diet. So today common problem we're gonna start with the asthma, sinus issues, okay, and upper and lower respiratory systems we're gonna talk about. So all the problem which is come into that category, we're gonna talk about it. Okay. So problem of the lungs and this year, even cold, common cold, hay fever, these are the common issues. Okay. And this would be the COVID problems as well. Today, modern problem, which is people are suffering from the pandemic. That's also include in that. Diet would be same. It's like ear is, yeah. So let's start with the diet. I already talked about it. Kapha diet would be very, very, has lots of precaution. And especially whenever you have issue of the mucus is your body is generating, one has to immediately go on the fasting. That I experimented on myself as well. Whenever I go sick, I go for the fasting, especially when mucus is secreting in your body. Even fungal infection or any kind of issues, especially female reproductive organs issues, when they get itching in their vaginal issue, right? Vagina area. That's also if you do the fasting and stop immediately having the carbs. And so yeast infection, growth of the yeast infection immediately, break down. these bacteria basically get the energy from the food and especially carbs and the sugar. So if you stop eating immediately, what happened? These bacteria doesn't get the energy. So immediately they stop growing, right? So fasting is very effective. That I personally experimented on myself. And whenever I get any problem, even during when I got the COVID, 3 days I put on myself on the fasting. I'm doing the liquid diet, following the liquid diet, and then though I feel so weak because uh, because of the sickness as well, and I get the dizziness and lots of weakness is there. But believe me, you're not gonna die out of weakness. Your BP level go down, but these, if you take the proper rest, your body gonna automatically gonna heal yourself, and then mucus, which is producing your body to take out the bacteria, it is coming out, flush it out. Okay, so we work especially kapha related, even in the sinus. Sinus is sinusitis when happen, and there is no cure in allopathy. Okay, what happened? I'll show you the picture, which give you better understanding. Uh, in sinus, I think COVID, you understand that it affect your lungs. Bacteria, when it reaches to the lungs gonna inflamed, and they get the pneumonia symptoms. The picture is visible to you. So these are the sinus in your body: frontal sinus, saphenite sinus, ethmoidite sinus, and the malexity sinus. Sinus is a hollow space in your face, which regulate and moderate the temperature of the air. Whenever you inhale, outside air is very cold, so it passes through the sinus hollow space, and then it's the temperature of the air would be changed and it become little warm, which is suitable for your lungs. Otherwise your lungs would be, and these other function as well of the sinus, right? So these sinus, if you see spectrum, it's like excess mucus is secreting through your nasal, and when it happened because of invasion of the bacteria, and this is the uh, body reaction to take out the bacteria through the, when body producing the mucus, it's in order to take out the bacteria with it. So you get lots of mucus in your nostril. But what we do, we take the antibiotic tablets and we stop the mucus immediately, and it remain in the nostril and it become hardened. And also sometime what happened, because you are not doing the cleansing procedure of your nasal cavity, so mucus remain in that cavity and it cause the inflammation. Okay, it become hardened and cause the inflammation. So yellow part which you are seeing, it's a mucus which is stuck in your nasal cavity, nasal in the hollow space, sinus area. And whenever the climate is gonna change, or any trigger, polluted environment you are staying, it's gonna trigger back, and then it start inflamming the area of the sinus, and then you feel headache, migraine. Sinus also trigger the migraine, and recently you have asthmatic attack, that's also gonna trigger the sinus. You're living in the polluted area, that's also gonna trigger the sinus. um, and you're working in the lots of chemical area, like where chemical paints are, um, companies or the organization which make the paints, or lots of strong smell. If you're working around that area where small smell is coming uh, around it, it can trigger the sinus. Okay, so causes many, and there's no cure for it. But yes, in yoga therapy we have complete cure. Okay, this is a sinus issue. Then other respiratory problem, that is asthma. I'll show you the photo. What happened in asthma? Asthma is basically related to the your air pipe, windpipe, your bronchi. Mm, just a moment. Can you see the two pictures of your the air pipe bronchial tubes, which we call, which attach with the trachea, right? Bronchial tubes get inflamed and tightened, okay, because of again the attack of the asthma, which make your bronchial tubes very sensitive towards anything, towards even if you're taking small stress, that can be triggered and make your bronchial tube sensitive, and it's swelled and produce lots of mucus. And when mucus is there and swelling is there, uh, the air could not pass from these pipe, and then alveoli, which is where exchanges of the gases is happening, carbon dioxide are released and O2 would be taken, oxygen would be taken to the cell. That's not properly functioning because the pipe is, there's lots of, it's stuck. Have you seen the pipe of water pipe? Whenever it inflame, water pipe has the fungus or and the green fungus, so water flow would be stopped. Same thing happen with your bronchial tubes. Okay, so bronchial tubes passing the air, when it's effectively working, it's passing the oxygen to your lungs, and then lungs would alveoli where and properly exchanges of the gases gonna happen. But when it swell and mucus is produced, then it creates the issue. It can be a bacteria invasion. It can be a same symptoms with the sinus. It could be like you have short breath issues, like you have anxiety attack, you have trauma. Asthma can, there's many types of the asthma. Maybe you are inherent since childhood you are having it, or it can be triggered in your puberty age or even any age. It can trigger because of a shock, some trauma you are passed recently, that also can trigger and make your bronchial tubes very sensitive. Any allergy attack, yes, again it can swell. Okay, so pollen, dust, and polluted environment can trigger the asthma. Cause reasons are many. But what happened? Your bronchial tubes are inflamed and stuck with the mucus. Okay, so this is the asthma. Then other issues. I have these two problems are clear. What happened? Then other problems related to the kapha related issues. Actually, the migraine, then the cold. Okay, COVID also happened because of whenever the bacteria invade in your body, you start bringing the imbalance in the kapha. Okay, so that's also. Then uh, um, other infection like ear infection or the throat infection also. Then bronchitis also happened because of the vat, kapha imbalance. But yes, vat also gonna imbalance, so it gonna spread the kapha. Are you getting it? Vat always spreading the kapha and always spreading the pit. So these issues would be controlled through the diet. And these other problems, but understand any problems which is related to the upper these areas and the lower respiratory system related to the lungs, related to the bronchial tubes. It could be asthma or any other issues short of the breath. It means somehow it's related to the kapha. Okay. Now asthma also caused by the vat and the pit also. Kapha, if dry asthma you are having, dry cough, it means there is a vat with the kapha is imbalance. When liquid mucus is coming, then kapha is imbalance. Okay. When you get the fever with these things, it means pit also gonna imbalance. It gonna increase the heat of the body. Okay, that's how you're gonna analyze the symptoms. Now the diet for, I already explained about the diet very much in kapha. Immediately stop having the dairy products. Okay, don't take the dairy products. All kind of ghee and carbs should be completely boycott. Liquid diet should be given to them. Juices, yes, juice should be good if they are under attack, like of even COVID. Liquid diet like gram flour. Um, you can use the black chickpea soaked under water, and you can make the soup out of it. Add the vegetables into it, and add the cumin, turmeric, garlic, ginger, these spices into them. Make the paste, onion, and little bit tomato and vegetables. Your favorite vegetables, but easy green leafy vegetable you can add, and then give it to them. Okay, they have to sip it. This soup is very effective and balancing the kapha along with the spices. Warm spices, yes, all these warm spices can be taken by the kapha. Little bit chili, yes, green chili you can give little bit if they don't have heat. Sometime when we are trying to bring the kapha balance, we give more spices, warm spices, so it bring the imbalance in the pit. So just make understand in moderation, you have to give the warm spices, okay? And like another thing, you can have the porridge, the black rice porridge, yes, good, along with the spices. Black rice with the moong khichdi, like black rice and the moong dal, green pulse, you can make porridge, salty porridge, and add again these spices, and then prepare in the handi, okay, clay pot, and give it to them. So these two meals, at least 5 days, 1 week, any kind of problem you are having, at least 1 week it required to bring the balance in the kapha. So these diets should be followed strictly. Um, Even especially in the COVID situation. Any symptoms you have, the cold, even normal cold you are having, immediately put yourself in this mode diet. Believe me, this will completely, it's quickly you get the result. Okay, but if you have the like aggravated situation, along with the doctor prescription tablets, whatever they are prescribing you can again follow these diets. So small, but don't keep maintain your blood pressure. Blood pressure go down because of we are not providing the carbs, sugar, so blood pressure go down. So in that you can have the piece of jaggery in your mouth. keep the one small piece of jaggery in your mouth, and that would be maintain your blood pressure. Okay. Then yes, black coffee, you can go for it little bit, one in a day. Okay. Otherwise, ginger, lemon, honey tea is good. Herbal drinks, ginger drinks, cardamom drinks, these would be good for them. Whole day they can sip herbal drinks. Don't give too much caffeine. Kapha can take the caffeine, but what I already told that when kapha go imbalance, Vat also started dominating. So caffeine bring the dryness to the body, and it's dietic in the nature. You start having lots of urges for the going for the pee. Okay, so caffeine once in a while, like once in a day, you can have, but without milk. Okay, without sugar, without milk. Immediately cut off the sugar. Jaggery will give you the energy, but not white. White sugar is completely don't take even if you are healthy. Try to minimize it if you like the taste of um, that white sugar. Okay. Now other things which you can do, juices. Juices should be prepared with the hand machine, which I talked about it. There is a traditional way. Don't use the mixie for that. Okay. Um, there's a small equipment is available which we do with the hand. That juice you can make it. Pomegranate juice. Okay. They can go orange. Yes, orange you can give by adding the warm water. Add the warm water in the pomegranate juice and the orange juice. Vitamin C should be given to them. Okay. And by adding warm water, then pinch of black salt according to your taste, black pepper and dry ginger powder, you can add it and then enjoy the juice. Only you can take these things. Because directly we cannot give them. And if their digestion is working efficiently, whole juice, instead of giving juice, you can give them the fiber, give them small fiber. So whole fruit should be given to them. They have to chew it. Again, adding these spices. They have to add the spices, warm spices into it. Okay. And then they can chew it. How you gonna give them? Not directly. Uh, roast on the flame of the gas, roast the pomegranate with the skin and heat. No coconut water shouldn't be given to them. Okay, in kapha, coconut water is cold in nature. Yeah, it has lots of benefit, but it increased the kapha. So coconut water, yogurt, immediately stop. Which I'm specifically telling you only these things, and how I'm giving the instruction only these things. When they have attack of asthma, attack of the COVID or sinus inflammation, strictly follow. Okay, no, nothing they can eat. I'm very specific about it. Anything they're gonna eat, if you're doing any other experiment, you never know how it's gonna react. Okay, and so yes, so these things should be given to them. How? Put into the hot water orange or mossami, okay, for 5 minutes, and then hot water means lukewarm, so it's gonna change the potency of the fruits, and then peel it and then make the juice, or you can have raw with the again with these spices. Okay, so this is the way, and take in the noon time. Juices and these things should be taken under the sunlight, not evening time, not early morning. Okay, under the sunlight, sit in the sunlight and then have. So if it increasing the kapha, because fruits are cold in nature, sun gonna pacify the kapha. Are you understanding? These things should be done. The way of doing it in this way. Okay. Then yes, properly given the sun bath, sun very much effective morning and evening. for bringing the balance to the kapha. Okay, so morning time, evening time, lots of sunlight should be given to them. And if the problems are aggravated, they cannot move their body. So keep the patient into this room which having the proper sunlight. Okay, and the bed should be near the sunlight. Okay, and use the neem गिलोय in their diet. Give them, this is very effective for bringing the kapha and improve their immune system. So गिलोय and GILOY, गिलोय, and neem and EEM. Tablets also available. You can lick, you can keep in your mouth. Don't, it has to be, you are licking the juice. Or if you can make the quath, kada out of it, fresh leaf and the branches you are using making quath. So quath, how you gonna make? Those quath should be take this those things, add the 4 glass of the water. How much you're gonna use? It's like 100 grams of, start with the 50 grams because somehow it's create the indigestion also. Take the leaves and the kada you have to make with the branch of the neem and the giloy. Okay, and leaf you can chew properly. You can directly wash it with the warm water and directly chew it. Both way you can have it, but don't take too much. Start with the 7 leaves or 2-3 leaves of the giloy if you fresh available. Tablet, one tablet you can start having morning time, but keep in your mouth for 15 minutes. Don't gulp it. I did the experiment on the way of taking the tablet and tremendous result. Okay, so you don't chew it, don't gulp it, keep in your mouth the tablet, lick it like how you take the candy. Children keep the candy in their mouth and they enjoying the taste. But I know the taste would be very difficult to handle it. But still, sick person don't have much option about the taste. So these things should be done. Empty stomach, morning and evening, twice a day. You can even you can start taking it if you have kapha um, body type and you lost lots of time, you get the cold and these things. Even normal day you can have the tablet morning and evening same way, so it doesn't have any side effect the way you are taking it. Okay, after 1 week you can observe, then take the 2 tablets, 1 meal. So 48 days you can have it and then stop taking it, and after 1 month again take the break of 1 month and then again start. Okay, that's how you're gonna do it. So after 48 days, so 48 days you have to take the tablets, giloy or the neem quath, whatever you are doing. Normal diet I already talked about for the kapha, but when they have attack, these things should be followed. Now come to the asan. Asan, all the chest opening asans, all the chest opening asans are good. So like chakrasan, bhujangasan, okay, then ostrasan, camel pose, all the twisting posture, where movement of the chest is involved, those asan you have to include with the hold 5 to 10 seconds, minimum 10-second hold, and doing lots of chest breathing, diaphragmic abdominal breathing and thoracic breathing. Both breathing is very beneficial. So hold in the 10-second in the posture, give the support of blocks, pillows, whatever they required in the modification of those posture, easy posture, and make them breathe, lots of breathing through the lungs and through the belly. Okay, so the lungs would be capable, these gonna allow to absorb more oxygen, especially in the COVID. Even doctors are also telling that you have to breathe more. And I these things, diaphragmatic breathing work effectively, especially you have lungs related issues, upper or lower respiratory problems. Okay, then breathing practice, yes, all the safe four breathing practice which I talked about, diaphragmatic, upper and lower respiratory issues would be cured, yes. Then Nadi Shodhan Pranayam, then yogic breathing, three division of the breathing, right? That's also. Then Kumbhak should be implemented along with these things. So 10 seconds of the Kumbhak, okay? Antara Kumbhak should be introduced to them, not more than that, okay? 10 seconds. Only 10 seconds, not more than that. Attention. Kumbhak become dangerous initial level, but 10-second Kumbhak, they can do it. Okay. So Antara Kumbhak, along with these practice, you can introduce. Then Bhastrika, Mandagati Pranayam, you can introduce to them. Okay, Bhastrika, Mandagati Pranayam, you can introduce to them. Then not major pranayam they can practice because their blood pressure can, especially somewhere in kapha, the blood pressure start fluctuating. So not major pranayam you can introduce to them. So leave it. You have to observe the history of the patient and go through it. You require more detail, but this is the safe practice. Then Shat Karma. Yes, Kunjal is very beneficial. Jal Niti, Sutra Niti, very beneficial. Tel Niti, yes, very beneficial. So mustard oil, I did the research on that. Mustard oil is very effective to bringing in the kapha. For Vat, you can use the ghee, A2 level ghee or Mahatrifla Grit. You can use it, but here you can use the mustard oil for kapha. So kapha people should use so they can lie down on the supine position, keeping the neck like this, okay, opening the nostril and use the drop, five drops in each nostril before sleeping daily, okay. Then put the oil in your ear, navel, and rest of the doors like your vagina or your anal region. These mustard oil, it would be burning, get the pure mustard oil, okay, from the market, or if you have any contact in the village, and this immediately and make the ritual, go with it. Okay, same thing if you have vat imbalance, go with the vat, uh, do with the ghee that we call kritaneti. This we are practicing with the tail, with the mustard oil, not any other oil, mustard oil. I did the research on the mustard oil and the ghee. So I know only these two have the tremendous benefit. Okay. So these Shat Karma should be practiced is bringing the balance in the kapha. Kunjal, yes, they can practice the kunjal as well. Then meditation. Meditation, kapha are very lazy, you know, and they're super lazy. So include if their body is ready to move, they are not during the attack. You can introduce the breath awareness. Anapana is good for them. Okay, if they are on the bed, Anapana is good for them. If they are not on the bed, pranav meditation you can introduce to them. Little bit walking meditation you can introduce to them. Okay, I'll gonna teach you walking meditation. So these meditation is very effective, but when they are on bed, passive meditation, when they can move, not in that thing like that level, uh, it's not aggravated much. then little bit movement with the meditation you provided. So body would be active and they connect themselves. And then later on, you can bring to them the passive meditation. So active start with the instruction with the active meditation. It could be like walking meditation. It could be dancing meditation, little bit movement of the body. And then you can include the passive meditation where they can sit and observe the breath later on. Okay. So these things you can introduce for the all the problems of the kapha. Okay, and these I hope these gonna help you. Even somebody having COVID, you can help them still. Uh, if problem is and you want more advice, you can contact me. You can contact the Himalayan Yoga Association. You can reach out to me. Okay. In pandemic situation, we have to help more people and spread these things to them. It bring more effective result because we cannot solely dependent on the allopathic, because allopathic doesn't have the all the answer. They are also struggling. They are trying their best, but with these things, the situation would be not gonna worse, not worsen. Okay, so at least we can control the situation. Any doubt you will have?
Ma'am, I have one question. If somebody has asthma and arthritis both, then that person is having both the imbalance is there in kapha also and in vat also. Then how to go about such people if they have both the things?
So in that situation, I already told you Vat and Kapha problem, they have the similar symptoms. One have the dry. So follow the Vat diet. Okay. We have to
Okay,
bring the
ma'am.
balance in the Vat first. Okay.
Okay.
And when the symptoms of the Kapha is aggravating, immediately put on them on the fasting and give them the liquid diet which easy digestible, but
Mhm.
give them the moisture also. So these diet is
Okay.
very general. Kapha diet also followed by the Vat people also. The
Mhm.
spices are same because both respond for
Yes.
the cold environment, right? So spices are same. Both are bringing in the balance. Like garlic, you can add in the Kapha diet also. You can add in the Vat. It bringing the
Okay,
balance
ma'am.
in the both. Neem and
Okay.
Giloy also three dosha nashak. So I talked about these two things you can give in. Don't think much. Which situation is
Mm.
more aggravating? You can give them, start with that, especially
Okay.
Vat quickly gonna aggravate. Okay. So start with the Vat, bring the Vat balance, give them heat therapy and everything. Kapha automatically gonna under control. Okay. And see the symptoms under the attack, like they have arthritis attack and the kapha attack same time, asthma attack same time. Give them breathing, lots of breathing. Take the medicine also. I'm not saying completely if they are taking for longer period of time, but along with the medicine, they can follow this diet as. So there is no uh, because spices are same. Okay,
Okay, ma'am.
spices are same. But only one thing, Vat cannot have raw thing. Kapha can go with the raw things as well. Okay, only these things. So
Okay.
give them the steam thing, steam vegetables, steam salad. It's bring the both
And this is
balance.
only when, like, suppose they have an asthma attack, that is the only time we have to follow this, not on the regular days.
Not the regular day. I talked about the kapha diet. Remember
Yes.
the
Hmm.
spices
Yes,
according
yes.
to that you're
Hmm.
gonna follow generally.
Okay.
And but when they have
Okay.
attack, kapha is so much aggravated
Hmm.
and it's affect your lungs and people are dying because of that. It's very difficult,
Yes.
and we cannot reduce the mucus. Problem is that mucus is not
Hmm.
stopped to coming out and it's stuck there. And if
Hmm.
you're giving the antibiotic and all other things, it's gonna become hardened and it's or stuck. And through any technology we
Hmm.
cannot take it out, right? So that
Hmm.
is the
Hmm. Hmm.
issue. we cannot solely depend on all the steroid and antibiotics and other things. We have to follow this therapy as well. So along with whatever medicine is going on, treatment, doctor are saying practice these things as well. Okay.
Okay, ma'am.
And maintain their blood pressure. That's why I talked about jaggery. Lots of herbal drinks should be include. Give them proper rest. Sunlight should be providing to them. Neem, giloy, these should be given. Vat and kapha both can take. Okay, these gonna help.
Okay, ma'am. Thank you.
So any doubt? So Om Shanti. Meet you in tomorrow's session. Bye bye. Take care. Bless you.
Thank you,
Thank you,
ma'am.
ma'am.